Dr. Catherine Connolly.
And Minister, I'd like to start on a positive note and thank you for coming back to me in relation to the compliance. You said you'd come back and you did, and it's actually worrying the level of compliance. But I have 6 minutes, so I'm going to make a few points in relation to this, but I wanted to start by thanking you for that. I have from the beginning asked for a human rights approach in relation to this topic. I thank Deputy Tobin for arising and asking for this to go on the Clár-Ibra. I've asked repeatedly in a proactive manner that the government come back to us so that we can engage in relation to this process. I make my comments, as I always do, in the knowledge and in the full recognition that we've had 5,369 deaths, that 88 confirmed cases are in ICU and 448 in the hospital. I make my remarks firmly in the recognition that we're dealing with a very serious crisis in relation to COVID. However, from day one, I've been most unhappy with the way the government before and the government after have continued to deal with this matter. In the beginning, I gave my full support to the draconian legislation on the strict understanding that it would be a partnership and that you would come back to us in an open, honest and accountable way. I have watched with dismay how we talk about opening up nightclubs and what appears to be a Cinderella dance licence where it's safe to dance after 12 o'clock, but it's not safe to open respite services in Galway. So into the second year of the pandemic, we have no respite services because it's not safe, but theoretically I can go dancing if I had the energy in a nightclub, presumably after 12 o'clock tonight. The Irish Council for Civil Liberties, and they have clarified in their press release, and I want to just say it because it's becoming extremely difficult to raise any questions in this country in relation to civil rights and in relation to alternative views in relation to how to deal with the pandemic. So the Irish Council for Civil Liberties, they actually qualified that they're a pro-vaccine organisation and go on to say we supported the rollout of the vaccination programme. However, at the same time, we respect everyone's right to bodily integrity and privacy in relation to their health. We believe vaccination and all medical treatment should be a choice, and I believe in that as well. And I believe that vaccination should be voluntary, and the strong message is to encourage, not demonise. And unfortunately, in your speech, you have continued with that narrative, as the Taoiseach has done as well, and it's an unacceptable narrative, and as the Irish Council for Civil Liberties say, it is counterproductive, or it could be counterproductive. I believe it is counterproductive. The government legislation on vaccine has created an infrastructure aimed at segregating and risk-scoring individuals on their health basis, which the Irish Council for Civil Liberties warned in July set a dangerous precedent. I fully agree with them. Now, 18 months into the pandemic, there's no evidence of any human rights impact assessment by government of COVID-related legislation, despite repeated calls from myself, the Irish Council for Civil Liberties and others. I've constantly called, as I've said, for a proper debate, reasoned and rational in relation to this, so that we can inspire confidence. I've asked, that, like the cross-party committee has asked, for an urgent investigation into the deaths in nursing homes. And I note with horror that they're now on the increase again. I have read in detail the report, and in a sense I feel a little sympathy for your Minister, because I've read in detail the 8-page letter from NEFID, and then there's 3 or 4 pages of an appendix. I note what they're saying, and it's of extreme concern. They say that, and just get the right letter, yep, October, disease incidence across the country is high and increasing. They go on to say that, in summary, the epidemiological situation in Ireland indicates a worsening disease profile with the future trajectory very uncertain. They tell us there are 5 criteria which are essential before we move to opening up in a full manner, and yet they go on to agree with you that we should be opening up. The 5 criteria, we've got one of them. At least 2 weeks having passed from the attainment of at least 90% vaccination, and you're telling us it's 92%. And then they go on to talk about hospital and critical care occupancy. We utterly fall down on that. They go on to public health capacities. We utterly fall down on that. And of course, they talk about the absence of a new variant of concern. If that happens, everything is unpredictable. But what we do have control over is hospital and critical care occupancy and public health capacity. And we have failed utterly on both of those, although I recognise your efforts in relation to increasing the capacity. And it brings a question to mind immediately of the private hospitals in Galway. Galway City has 2 closed wards. The head of SAILTA, Mr. Connolly, was on the radio last week telling us there were 2 closed wards because of COVID. This is a hospital that was under crisis continuously before COVID and is much worse now, and staff who are at breaking point, and my heart goes out to them. But we have 2 private hospitals, and the last time we talked about all of the things we learned about taking over the private hospitals and using them. They're not mentioned anywhere. It's extraordinary. We have 2 hospitals. One of them was seriously under capacity when COVID started, and I wouldn't say it did well out of COVID. It would be a very bad way to put it. But it was used appropriately, or should I say not appropriately. It was used theoretically, but actually remained underutilised. So, Minister, perhaps you could tell me about that. Perhaps you could tell me about the absence of respite services in Galway. If we have 92% vaccinated, where are the respite services? Sorry, I'm benefiting from the clock at silent. I presume I still have 4:37, but thank you.
It's stopped for a while.
The respite, well, I've indicated here. Anyway, thank you. So I actually, Minister, I'm going to send these 2 letters to you and the 2 junior ministers, the 21st of October and the 24th of September. I don't expect you to take this in my rapid speech, but I'll just show you what we're dealing with. Health Executive telling us 2 agencies in Galway, waiting lists for respite services. For children, 34. For enhanced services, 14. For adults, 45, and so on. And the figures below, these are low figures. Then we look at this one and we ask them to break down the agency from 0 to 3 months up to 4 years. And at the end of that, we have 89 adults waiting more than 4 years. Now, something is either wrong with the reply, but I'm only reading out what I have in relation to respite service. And there's a whole range, so I can pick 8 are waiting 2 to 3 years, 6 are waiting 12 to 8 months, and children. Now, to get that information alone has been a marathon, and it was with the help of your department that we got that information. And it's truly shocking that people are waiting prior to COVID and after COVID in relation to the most basic services. And indeed, I know, because I've seen it in Galway, I'm on the ground all the time, and people they're amazing actually, what they're dealing with in terms of care and saving the state a fortune, loving the person with them who are very vulnerable, with absolutely no respite. Now, that's what I see, and then I see a discussion on Cinderella licences and whether people can dance after 12 o'clock, and a split and divide of our population, which is totally unacceptable. We did this in the beginning in a sort of gentle way, but an insidious way, when we told those over 70 that they had to stay in their house, and months later said, no, we didn't really say that to you, we just encouraged you. And we're doing the exact same thing again now, while we're ignoring the fact that the 5 criteria set out in that very long letter from NEFID have been ignored, one way or another. And it seems to me that we should have learned, and I have to keep asking, why aren't we learning? Why aren't we learning that you cannot put all your eggs in one basket? NEFID are even saying that, because they say in their letter that there could be another variant, and the existing variant, that the vaccinations will not deal with it. And yet you're writing speeches, or somebody is, and other TDs are in to demonise those who make their decision in the full knowledge of what's best for them, while complying with all the rules. I have no time for somebody that doesn't comply with the rules, or not wear a mask, or endanger anybody. But ultimately, it's a decision for the person. And so we're persisting in this divisive manner, I believe, to ignore what's really happening, to ignore the absence of human rights assessment of any piece of legislation that we've passed. Indeed, we're talking here today without any regulations in front of us. We have no regulations, unless I'm wrong, Minister, unless they've been published. But I'm talking here in a vacuum. Very little information on ventilation. Indeed, over the past few years staying in a hotel, not in the hotel I'm in now, I've been in hotels where the window didn't open. Just as an example, building regulations allow that. We've allowed a system to develop where ventilation has not been built in as a necessity. We have refused to look at antigen testing, and we have failed utterly, in my opinion, from the beginning in relation to testing and tracing. And now we're going to demonise and isolate and turn one against another when that's totally unnecessary. Now, I would ask you, in all of this, how do you stand over the confusion and the contradictions? Nightclubs, as I said, reopening, but respite still closed. We're all in this together, but yet we're going to divide and conquer. Negative COVID test is sufficient for unvaccinated people to travel to Ireland, but not sufficient for indoor dining. CO2 monitoring has been mentioned by other TDs as well. I could go on, but I've got the benefit of extra time and I won't. But Minister, I close by saying, it's extremely difficult for me to go out there and inspire confidence with the confusing, contradictory messages we're getting and with the divisive nature of the messages coming.